what would you like to say about HealthTravo?
The surgery was robotic.
How was your experience with the doctors in,
Hospitality-wise, I think this is one of the best.
Would you like to recommend HealthTravo and their services to anyone?
Very much would want to.
As you mentioned about the food, I would like to ask the next question. Hello everyone, I'm Anindya. I'm from HealthTravo. Today we have Dr. Amu from Fiji. He came here in India for his medical treatment, and today we would like to know about his country, his profession, his introduction, as well as the complete medical journey, starting from taking off from his country and landing in India, and how everything went well. And the treatment has already been done in Yatharth Hospital. So today we have Dr. Amu. So Dr. Amu, I would like to ask you from HealthTravo that please first you introduce yourself and with your profession and everything, please.
All right, thank you. Good afternoon. I'm Dr. Mobolaji Amu. I'm a Nigerian Fijian, currently living and working in Fiji as a medical doctor. Yeah, I think that's basically the summary of who I am in person. Regarding my experience, I think that's quite an interesting topic. I connected with HealthTravo on LinkedIn, and I talked to Mahim, and from there we started talking. When I discovered that I had a medical condition. Well, my medical condition is basically has to do with the kidneys, where the urines are not draining. The urine from the kidney is not draining properly, and that's particularly my left kidney. It's called hydronephrosis. I'd consulted a few doctors back home, but then the options of surgery being offered, I wasn't too comfortable with it. So I decided to look out and look elsewhere. Hence, I was able to meet up with HealthTravo via LinkedIn, Mr. Mahim. He actually helped a lot. After discussion and sharing my various investigations with him, he connected me with various hospitals over here in India, the likes of Max, Apollo, Yatharth, and quite a few other hospitals, and shared the quotes with me. I even had the privilege of meeting with of having a video consultation with some of the doctors while I was in Fiji, and discussing my conditions with them from different hospitals. And I ended up choosing Dr. Dushyant from Yatharth Hospital after going through his profile of multiple renal surgeries, renal transplant surgeries. I discussed with my GP back home and also with my own urologist at home in Fiji, and he also advised that yes, that the procedure Dr. Dushyant was offering me is probably one of the best I'll get anywhere in the world.
Great.
Dr. Dushyant had offered me robotic pyeloplasty for the management of the kidney condition, and that really helped. It really helped with the way and manner he had explained the procedure during the video consultation. Throughout my time before coming to India, I would say HealthTravo was really there. They kept on checking up on me, whether I was still interested in coming over, in coming for the surgery. Mr. Dushyant and Mr. Mahim were always trying to ensure that my health was okay, even when I was in my country, in Fiji, up until the time I decided to make the journey down to India. And throughout the visa process, including securing the visa, the transport, applying for the various air tickets, which one to apply and how to go about it.
Right.
The HealthTravo as a company was there with me. Then at night, daytime, anytime I call, it seems Mr. Mahim wasn't sleeping. He was always there to pick up the phone. And then on arriving here in India, they were also there. Mr. Mahim and Mr. Dushyant were there right at the airport to pick myself and my medical attendant together.
Okay.
We were picked right from the airport up till they secured an accommodation for us, and also till we were able to reach the hospital to see the Dr. Dushyant in person.
That's wonderful. I mean, I had a couple of questions related to that. I did not have to ask those. You have already explained everything.
Yes.
Is this your first travel out of your country, Fiji to India, or it's
Yes, coming to India, this was my first time coming out, and especially for medical treatment.
Medical treatment.
I've been out of Fiji a couple of times to other countries, but coming to India, this is my first time.
In one line, if I have to ask you, or if you have to say about HealthTravo, how was your assistance in terms of assistance and hospitality? What would you like to say about HealthTravo?
Oh, the HealthTravo as a company is, I would say they've really tried. Hospitality-wise, I think this is one of the best anyone would receive. Assistance. An example of that rather is right from picking from the airport to securing accommodation, to securing your own SIM cards where you can use to call, to assisting with pickups and drop-offs, going for the clinic, even going through to help you with investigations, to make sure that you got your investigations done. I really didn't have to do much. They were there running here and there, making sure that all that needed to be done is done. And up to seeing the doctors, visiting before the surgery, after the surgery, even when I was recovering and even after the surgery, they were always there. They've been there. And even helping with the follow-up, the reviews and all that. So hospitality-wise, I think is one of the best you would ever receive anywhere in the world.
Thank you. Your words means a lot for HealthTravo. And how was your experience with the doctors in Yatharth hospitals, and overall, how is it like your treatment and your surgery? Yes, of course, your surgery went very well, but for your experience, you would like to know about your experience. So, yeah.
All right. Well, initially there was that fear, of course, coming from your country to another country to have a medical care. But on arrival at the hospital, there was just this calmness. You could see, and you could just see that, okay, I'm not in shock, and I'm not in somewhere unexpected. I'm actually in a hospital center. So the first thing you want to notice when you approach here at that hospital is that big, tall building, and with the properly labeled hospitals and well organized, spacious, and that was something very, very important to break the anxiety and the fear for a surgical patient from another country. And yes, we met the doctor. The doctor was super nice, was very friendly, and it was also very blunt in the type of procedure and what is expected from the procedure and all that, including what's going to happen before, during, and after the procedure. And yes, the admission went well. While I was there, I stayed in a private room, and it was probably hotel standard. I would say even a 5-star hotel standard, with everything you need. The food is being served. The nurses were checking up on me almost every now and then. You had attendants to help you out, to help you clean your room, to help you take care of your stuff, your food. And also, most importantly, my medical attendant was also attended to. So it was not just attending to me alone. They also made sure that my attendant was not left out in the care and hospitality that was extended. Post-op went well. Yeah, the surgery was robotic, and there wasn't much pain. They made sure my pain was being managed with adequate painkillers, and made sure that the wounds were clean. The hospital was clean, so apparently I was at peace, knowing that the risk of infection is also less. And yeah, it all went out well, and post-op was really good. And the doctor also scheduled you for a follow-up review and also a lifelong contact in case anything happens or you want to contact him for anything. He made sure he kept the channel open, the channel of communication open for feedback and all.
So that's great. I mean, yes, this kind of experiences, it encourages us to work better towards work for people and elevating elevating the life of all. As you mentioned about the food, I would like to ask the next question is, you are being a Nigerian Fijian, so and first time you are coming to India, I can assume that you never had a taste of Indian delicacies before. So when you came here, you have been offered with the Indian food, I'm sure. So did you like it? Not like it? What was your experience about that?
Oh well. Living in Fiji, I had a bit of Indian food. The curry, the biryani, the palau. So, but on arrival here, the hospital took into consideration that I'm not an Indian, and they gave a variety. So I had options of choosing between English food type of food or the native Indian food.
Okay.
So while I was in the hospital, and they gave that option, and I was able to select whatever I want. But outside the hospital, and this is where the HealthTravo came in, they assisted with ensuring linking me up with the various online food.
Like
More like Zomato,
okay.
the Blinkit, the apps to where I can always order food or order foodstuffs, so I can cook my own food if I want, or I can order a food stuff immediately, and that actually helped. So I could order food, and I could also decide to cook my own food, and that's what I've been doing while I'm here.
Oh, no, that's great. And now, so as you mentioned in about the surgery, it went well, almost painlessly. So, what is the current? I mean, doctors have said when you'll be completely recovered and walk like anyone else, or you have already walking like a normal life.
Well, because the first 2 days after surgery, of course, there was pain and a bit of restriction. But like I said earlier, the pain was well managed. But after 2 days after surgery, I could say I was already as fit
as normal.
as normal.
So I can see in your T-shirt it is mentioned that Fiji rugby.
Yes.
So now, are you as fit as to play Fiji rugby?
Okay,
now?
maybe not that adventurous, but I can say I'm able to go about my normal life without necessarily cowering in pain or locking myself in. I've been able to walk around. I've been able to move around, and I'm not feeling much pain as it would have been if I had had an open surgery. And it has been very, very more like a painless journey after surgery, and especially after discharge, 2 days after discharge.
Okay.
Yeah.
So next question is, would you like to recommend HealthTravo and their services to anyone back home for your countrymen or around the world, wherever you have network connections?
Very much would want to. And I would like to say this, if there's anyone that wants to come to India, or you have any medical condition at all, and you think you're having difficulty with the care, you can always depend on HealthTravo and the medical services you get in India. it's really one of the best you would receive anywhere in the world.
Thank you, Dr. Amu, and thank you, our audience. You have heard from the horse's mouth. The Dr. Amu himself is a physician, and he came to India for his medical treatment, and he is satisfied with the treatment options, treatment facilities given, and as a medical value travel facilitator, HealthTravo, how they helped in terms of assisting and providing all the services required, not just as the medical value traveler, but as considering our patient as our family member. So taking care of completely personal and in a professional manner. So it's good to hear from Dr. Amu. So if Dr. Amu can come and Dr. Amu can trust HealthTravo, so do you. So thank you very much. Thank you, Dr. Amu, for your time.
Thank you
I
so
hope the rest of your days staying in India, you will have a wonderful stay back and visiting different places like Taj Mahal or other places maybe.
Yes, that is planned. That is planned already.
Yes, we hope to see you have a good memory carrying back at home.
Yeah, thank you so much. I really appreciate it. Again, to everyone, choose HealthTravo. If you need any questions or query, feel free to contact. Thank you.
Thank you.